Now, Meet the Press, the prize-winning program produced by Lawrence Spivak. Ready for this spontaneous conference are four of America's top reporters. Please remember, their questions do not necessarily reflect their point of view. It's their way of getting a story for you. Here now is the moderator of Meet the Press, Mr. Ned Brooks.
Welcome once again to Meet the Press. Nearly 2 months have now passed since the Salk polio vaccine was pronounced a success. The inoculation program got off to a rapid start, but it soon found itself bogged down in a series of difficulties. The climax came about 2.5 weeks ago when the distribution of the vaccine was suspended and a re-examination of the testing standards were ordered. We've now been assured that the program is getting back on the track.
During 1952 and 53, the U.S. experienced an outbreak of roughly 95,000 polio cases, with a death count of over 4,600. Millions of dollars were invested in finding a vaccine.
Surgeon General of the Public Health Service, Dr. Leonard Sheely.
The first effective polio vaccine was developed in 1952 by Jonas Salk and a team at the University of Pittsburgh.
And also in helping to set up the voluntary system of distribution.
On March 26, 1953, Salk went on CBS Radio to report the first round of successful tests. Beginning on February 23, 1954, the vaccine was tested at Arsenal Elementary School and the Watson Home for Children in Pittsburgh.
Now, Dr. Sheely, if you're ready, we'll start the questions with Mrs. Carpenter.
As the mother of 2 children in the most susceptible age group, Dr. Sheely, I'm primarily interested in one thing: the safety of the Salk vaccine. And during this re-examination period, I wonder if anything has come up which makes you question the safety of the vaccine.
No, Mrs. Carpenter, we still think the Salk vaccine can be made as a safe vaccine. Our new standards are going to make it, if anything, just a little safer than it was.
Then in the future, no American mother need worry about having her child inoculated?
No, I think not. I think this vaccine is as safe as man and the tests available to us can make it.
Mr. Spivak.
Dr. Sheely, do you know now that it's safe as a result of the new tests that you have made?
Yes, the new standards should assure that the tissue culture tests will give us a degree of accuracy that should assure that the vaccine will be safe.
Well, now, Dr. Sheely, those standards haven't yet been tested on any large number of children. They're still pretty theoretical, aren't they?
Jonas Edward Salk was born on October 28, 1914 in New York City, the eldest son to Russian Jewish immigrants. He earned a medical degree from NYU School of Medicine in 1939 and became a doctor at Mount Sinai Hospital. In 1942, he went to the University of Michigan to develop a flu vaccine. He soon became assistant professor of epidemiology. 5 years later, he was appointed director of the Virus Research Laboratory at the University of Pittsburgh School of Medicine. His main mission? Develop a polio vaccine.
That you're not just as wrong again as you were then. You're still operating in the laboratory. You haven't yet tried these new serums on children, have you?
Salk believed his vaccine, composed of killed polio virus, could immunize without the risk of infecting the patient. He gave the vaccine to volunteers who'd not had polio. All developed polio antibodies, but experienced no reaction to the vaccine.
I believe that Dr. Salk and the other men who have served us who are serving us as consultants understand these problems well enough to be able to give us good advice.
In 1954, national testing began on 1 million children. But in April of 1955, soon after mass vaccination began, some patients contracted the disease after being vaccinated. These vaccines were manufactured by the Cutter Pharmaceutical Company. In response, the Surgeon General yanked all the vaccines made by this company from the market. Soon, the Wyeth polio vaccine was also reporting to paralyze and kill several children. It was discovered that some vaccines made by these 2 companies had not been properly inactivated, allowing live polio virus into more than 100,000 doses.
Use these skilled scientists in reviewing the materials and giving us advice on what we should do.
The next month, the National Institute of Health and Public Health Services established a technical committee to review all polio vaccines. The problem was quickly remedied.
They may, if they wish to, go out and visit plants. On the other hand, we hope to have a number of men who will be visiting plants rather frequently in the future, who will be reporting their findings to them from time to time.
Now, are these experts also going to try to find out what happened to the vaccine that went bad, the lots that were manufactured out in California?
Yes, we have been discussing our findings in that situation as we have them to date, and we will be discussing the total of our findings with them prior to making our report.
Now, have they found any live virus in any of the vaccine that was given to date?
In the 2 years before the vaccine, the average number of polio cases in the U.S. was more than 45,000. By 1962, that number had dropped to 910.
We're still studying that.
Is it possible for a live virus to be transmitted by air?
Jonas Salk purposely never patented the vaccine or earned any money from his discovery.
And with proper techniques, it shouldn't be so transmitted.
Did this plant have proper techniques?
Until we have our full report, Mr. Blair, I can't give you fragments from it. I'm still awaiting the full report from the National Institute.